So without further ado, I'd like to introduce our keynote address for the day. So I'd like to invite Paul Farmer, the Chief Executive of Mind, to the stage for his talk.
Thank you, Katie, very much indeed, and good morning, everybody. It's really good to be here at this event, and thank you to the OFS for really placing a spotlight on mental health. And I know you feel as though you might be slightly constrained about what you can say because of the pre-election period, but I think it's incredibly important that the OFS is really paying attention to this issue of mental health amongst students and indeed in universities and higher education institutes more broadly. I, along with many other people with lived experience of mental health problems and campaigners in the Mind network, will be definitely asking all candidates from all parties what their plans are around investing in mental health, both in the student context and also more broadly. So let's just get that one out of the way now, shall we? And we're done. I also think it's really important for us to start by thinking about our own mental health and asking ourselves a very simple question. Are you okay? Really? Are you okay? Because quite often, I think we think about mental health as being that issue that affects people over there, the people who aren't okay, the people who aren't well. But in this context, and I think in all the work that we do at Mind, it's important for us to think about our own mental health and what we can do to support our own mental health. And that's also an important part of this whole area of work, because I think slowly but surely, we as a society are seeing this quiet revolution taking place around mental health as we begin to think about and understand more about our own mental health, but also the mental health of others. And the work that we're doing across societies and across communities really reflects the importance of thinking about our whole society and our whole community, as well as focusing on those people who experience mental health problems. And I suppose one of the ways for us to think about it as we start by thinking about our own mental health is to think about the extent to which perhaps all of us at some point in our lives will be located in one of three spaces. And these are very movable spaces. You might be thriving today. You might be feeling quite good. It's a lovely autumn day. You walked across the park. You took notice of your surroundings. You're feeling positive about coming here and learning about the issues that are in this conference today. And you're feeling generally okay about your general well-being. But you might be struggling. You might be beginning to feel that life is not on your side. And as we heard from those vloggers there, we know that sometimes what happens in different aspects of our lives impacts on what we're doing on a day-to-day basis. And so that sense perhaps that we might be struggling, that maybe things aren't quite as good as we hoped, maybe things are not going as well as we would have liked. And then finally, we might not be well. We might now be experiencing a mental health problem. We might be finding ourselves in a situation where our mental health has overtaken us to a point where it becomes one of the biggest priorities of our life in order to help us get back on the road to recovery and to recovering life, which has both that support and respect. And these changes that are taking place as we think about this issue of mental health are changes that are taking place across society. And it's important to stress that, I think, because what is happening inside universities and higher education institutions and amongst the student population is a reflection of what is happening inside wider society. We are beginning to be more conscious about the issue of mental health. We've spotted that it's there. We don't really understand enough about it. We want to find out more about it, and we want to know what we need to do. But we also know that the solutions are sometimes hard to find and hard to come by. But right at the heart of this quiet revolution are the voices of those people with lived experience. I think it's brilliant to hear those vloggers and also to hear from Katie as well, talking about their own lived experience, because that is one of the most powerful ways of removing the stigma around mental health that has for far too long shrouded this area. It's got in the way of us being able to make significant progress. Now that's beginning to change, and as that begins to change, we begin to understand both the true scale of the need and also some of the issues that we need to pay attention to. And I suppose the starting point is that 1 in 4 figure that we will probably be familiar with amongst the general population of in this country is underlined by some demographic and population shifts. Now, broadly, the mental health of our country is not getting any better. The best data around this from the Adult Psychiatric Morbidity Survey has relatively, in the last year or so, given us a picture about where our mental health is increasing or decreasing. And it is decreasing in 2 particular population groups, 2 groups that are really important to you. The first group is the under 18s, where mental health problems have shifted from 1 in 10 young people to 1 in 8. And the second group is amongst the 16 to 24 age group, particularly young women. So if you're wondering whether there is an increase in mental health problems or whether this is just simply something we're talking about, well, both are almost certainly true. And that means, as you heard from one of your vloggers there, that people are may well be arriving in university with untreated or undiagnosed mental health problems. And that places a particular pressure on higher education institutions to think about how you can effectively respond to that. Now, we also know that although going to university is for many people the happiest time of their life, it can create and bring its own pressures and challenges. And we know, for example, that the benefits of a positive university experience in terms of your longer mental health are quite clear. Strong social networks, better employment prospects are 2 of the many benefits of going to university. And these are protective factors for your long-term mental health. So going to university is good for you, very good for your mental health in the long term. In fact, when I've struggled in my personal life, in my mental health, the people I turn to first have been the friends I made at university 30 years ago. But we also know that survey data tells us that on average students are less happy and more anxious than non-students. And a large survey of 38,000 students found that 21% had a current mental health diagnosis, 33% experienced a serious psychological issue for which they felt they needed professional help. And also that young people have lower well-being scores than the rest of the general population. And that is, of course, because there are some risk factors that make that we have to pay attention to. The academic pressure, the financial pressure, sometimes the loneliness of arriving in a new university, knowing nobody. Sometimes the experience of trauma, which is obviously an issue you're going to focus on a lot more in your the second part of this conference. And also issues around care coordination. And I know that this has been a focus for a lot of work that's been done around student mental health in terms of really trying to make sure that we work out how people get effective help and support from the NHS when they really need help, particularly when they're not necessarily close to the GP who might have been supporting them when they were at home. And finally, we also know that young people experience multiple risks. Some young people will experience multiple risk factors, which can increase the severity of the impact of an elevated mental health risk. Now, there have been some changes over time, and it's important to stress that actually the story for student well-being is now kind of plateauing. It's flattening out a little bit after a worrying period. And it's also really important to stress that we are still very much in the early days of trying to understand the complexity of the nature of student mental health. But the good news is that there is already a real sense of momentum around changing this conversation around student mental health. And I particularly want to pay tribute to the work that Rosie and Student Minds have done, and also the UUK's work, the Student Mental Health Services Task Force, which has really, I think, started to bring to the fore the importance of prioritising mental health in our universities. And in similar ways to many other environments, which we'll talk about in a moment, that is almost the starting point, to see that issue of mental health as a priority for your university. And we've seen that starting to take place. We've seen various initiatives, and the Office of Students Challenge competition, I think, is a really good example of that, as we seek to find good practice, innovative practice that we can effectively evaluate. And I'm also pleased to say that we at Mind have also just launched this year our new programme, piloting in 10 universities over 2 years, to support students, staff and employers, which involves tailored training for students on managing the mental health at university, individual resilience, and also preparing for the future in the workplace, and tailored training and support for staff to become workplace mental health champions and peer supporters, along with support for universities to meet the Thriving at Work employer standards. And for those of you who don't know, the Thriving at Work report was a report published by the government, what is, I suppose we could describe now as the previous government, which set out a set of employer standards for all organisations to follow. But we know from the work that we did in Thriving at Work that every sector is different. Every sector has its unique dynamics, its unique workforce challenges, its unique consumer challenges that have to be taken into consideration. And I think for us, this is the kind of test and learn phase in our work with, in terms of our work in higher education, for us to understand collectively as a community what it is that is unique about the higher education community, what is it that we need to particularly address, and what are the kind of interventions that are going to have the most impact for the most people over a period of time, whilst also recognising that there are particular minority groups where the risk of mental health problems will be even further elevated. And your briefing note published on Monday really, I think, shines a light on particular experiences of particular groups and particular ethnicities, lesbian, gay and transgender communities as well, thinking about how do we really provide the right kind of support. So this is both a majority issue and an equalities issue to address. Now, one of the things I've been asked to do today is to talk a little bit about what we've learned from other sectors. And I thought I'm going to pick a completely different group, the work that we've done with the emergency services, the blue light services. And at one level, you might wonder, what have the blue light services got in common with students? And to some extent, the answer to that is not very much. But I think that we could perhaps can learn a little bit from some of the work that we've done. Because when we originally started to think about working with blue light service personnel, we understood that this was a very difficult area where you might think that tackling stigma was going to be a tall order. Let's hear.
I think in days gone by, we were seen as people who wouldn't be affected by the things that we see, but it still affects us enormously. If I was to look at my mental health, I have had periods where I've been really depressed, really down. There was a time where I wanted to end my life. I didn't, and that was primarily because of my son. I didn't want my baby growing up without a dad. I'm now a great believer in talking about mental health within the emergency services. I do manage my mental health as well as I can. After a stressful day at work, I will usually go home and go straight out for a run before I do anything else, just to calm me down and relax me. I've been working with Leeds Mind now for probably about 2.5 years, and it was one of the best decisions I've ever made. We spoke about peer support and how we could implement the programme, the peer support across Leeds. It surpassed all expectations, which showed to me, one, that we had previously underestimated the effects of mental ill health on our staff, and two, that staff were now happier to actually come forward and talk about it. As a result of the success we had, this peer support has been rolled out force-wide now, so the whole West Yorkshire Police now has peer support in each district and each department. It's made a massive difference. Not only to the people being supported, but also for the supervisor's confidence in dealing with people that are suffering crisis, that are going through mental health issues. It's not always an easy thing to deal with, but with the training we've had from Leeds Mind, it's just kind of reinforced that we do know what we're doing and we are there to support our staff.
So the approach that we took with emergency services was to think about the strands of work that needed to be done to take a whole community approach, starting with tackling stigma with over 3,000 workplace mental health champions signed up across England and Wales, empowering employers to have confidence by signing the Time to Change Employers Pledge, training line managers to understand how they can ask that "Are you okay?" question and really mean it, roughly 9,000 of those. Making support more accessible by having a dedicated blue light service with calls to a helpline which was outside of the mainstream of the HR systems in the blue light system. And building individual resilience through a programme of work that enabled staff to be able to think about how to build their own mental health capabilities. And then completing that loop by sharing that good practice locally through creating networks of peer groups and learning communities of practice. And when we asked people at the start of the programme what they thought, these were the figures of the kind of lack of engagement. Important to say that this is a very large group of people, but it's also important to recognise that some of the stigma amongst young people has already been removed. So we might be starting in this place from a slightly different place in terms of the levels of confidence. But this programme, when you look at those numbers, helped us to shift the figures. So over the period of time, respondents said that the number of people who were happy to talk about their mental health had moved up from 29% to 64%, and the proportion of people who were aware of mental health support had risen from 46% to 65%. And a rise in personnel who said their organisation supports people with a mental health problem up from 34% to 50%. And 60% of people said they felt confident attitudes towards mental health at their organisation were changing for the better, and 56% were confident that the mental health support was also improving. So those might be some of the indicators that you might want to think about applying in your own communities, in your own universities over the course of the next 2 or 3 years. And finally, just to mention a few future challenges. And the theme of the conference today is about it both being a campus and community issue. And there are, of course, challenges in terms of the capabilities of the NHS to be able to provide timely and good support, and that needs to be a focus for the NHS in its long-term plan, and it is. There are also, as we're already beginning to understand, we need to understand more about the true scale of the problem, the types of needs that young people have, and what kind of support really works, and particularly thinking about those test and learn initiatives where we want to understand more about the types of support that make a real difference both now and in the future. And also, I think, clarifying the roles and responsibilities. The roles and responsibilities of individuals, of the universities, of the state through the NHS and local government and other key players, and also the role of universities as employers of very significant numbers of people in communities. So, of course, the answer to the question, is it a community or campus issue, is yes, it's both. But partly this is all about us working together, both as a university community, as a mental health community, and as a wider society, to really make significant strides. When you listen to the people who are talking about how they struggle with their mental health issues, how they failed to get the help and support that they really needed, how lives were ruined, and in some tragic cases, lives lost, we have a duty to really take this issue seriously and commit to this being a priority for our universities. Thank you very much indeed.